Uh, well, uh, I guess what I wanted to first say is, have you heard of the psychiatric survivors movement?
I have not.
Well, let me just, if you don't mind, give you a little bit about it here. The psychiatric survivors movement is a diverse association of individuals who either currently access mental health services or who have experienced interventions by psychiatry that were unhelpful, harmful, abusive, or illegal. And I'd like to add to that that I've been harassed, I've been stalked, and I've been given medicine without my consent. And I don't know if you want to see some examples of that, but I mean, with the nurses that have, you probably talked to the nurses that have come by my house to babysit me. You know, at my age, I don't need a babysitter. And I'm just frustrated. I'm angry. And I just think it all needs to be put to a stop.
Okay. So, again, Craig, at this time, you are a patient working with me who is not certified under the Mental Health Act. You have been adequately treated with the medications so that I believe you have the capacity to make decisions with respect to your health care going forward. If you don't want to have the nurses come to your home, you can refuse them access, you can decline their service.
But will I get locked up in the psych ward if I do that?
Only if your mental health deteriorates.
Can
Only if you
you
become acutely psychotic.
can you describe my mental health?
Well,
Like, what was it? What were the symptoms that you saw in the beginning that indicated that I had a mental health issue?
there was symptoms of psychosis.
Well,
That
can
was
you describe
symptoms
that, please?
of, so let's see here.
You don't remember off the top of your head?
Well, we first met back in
You said that
2021.
you said that based on what my wife had told you, that you were diagnosing me with having psychosis. Well, shouldn't my wife be able to say whatever she likes about me without me being persecuted for it? As long as I wasn't threatening anybody or causing harm to anybody. You've never asked me if I've ever attempted suicide. You've never asked me that. And the answer is no, I've never attempted suicide. I don't have a list of assault charges on me. So what makes you think that I would be harmful to myself or anybody else around me? Can I just ask you that question?
Mm-hmm.
What were the symptoms?
So I felt that there was tangentiality in thought stream, that you made
Sorry, say
statements
that
of,
again. Can you say
I
that
thought that
again?
you had some tangentiality in thought
What does
stream.
that mean?
That means that your thoughts weren't linearly lining up. They seemed to jump topic to topic and move around quite a bit. So some
Yeah, but do
disorganization.
I not have freedom of speech? Do you believe in freedom of speech?
It's a different symptom that does nothing to do with freedom of speech, Craig. Of course you have freedom
Should
of
I not be
speech.
able to say whatever I want to say as long as it's not harmful to anybody else?
Of course you can. There's also some concerns that you experienced some delusions, a feeling that you've been robbed by your ancestors and extinct for 2,000 years at the time, that you didn't fit in society, and that you weren't even let's see here. Yeah, something about not being a part of the species of
I
humans.
should be able to say whatever I want to say as long as it doesn't harm anybody else or anybody around me. That's called freedom of speech.
Fair enough. Well, Craig, do you have any other questions about how you were initially assessed and wound up treated?
Yeah, I just want to know what the difference is between me and someone who doesn't have a mental illness is.
Well, it would be the symptoms of mental illness that you experienced.
And what were those
You
symptoms?
endorse symptoms of depression. You endorse symptoms of psychosis, although the entire
I'm more
time I
depressed
have...
now than I was back then.
Okay, well, how can I assist you with that today then?
You
Would
can
you like
free me.
information?
You can free me.
For you in what way?
As in, stop harassing me, stop stalking me, stop sending nurses to my home.
In what way have I been harassing or stalking you?
Well, I constantly have to keep meeting with you. I have to come in and take medication that I don't want to take.
So
Humanitarians have
I
come
have
forward.
Again, I have told you multiple times, Craig, that you're not certified under the mental health act at this time, which means you can choose to stop taking your medications and you can choose to stop seeing me. The risk to doing that, just so that you're making an informed decision, is that if you stop your medications and stop following up with psychiatry, you could end up ill and admitted to hospital again. That wouldn't be because I'm monitoring you in
Was it
community.
something I said?
Because if you were to get ill again. So
Was it something I said, or was it something my wife said about me?
It was a combination of the information you provided me and collateral information I received from your wife at the time, which is often...
And how do you know she was telling the truth about me?
To provide information and do assessments. Again, it was a combination of what you told me and what I was seeing in working with you, and then collateral information from your wife, which seemed to align with my concerns with respect to...
How do you know she was telling the truth about me?
Well, how do I know you're telling me the truth about
you? Exactly. How do you know I'm telling the truth about you? How you can't take a...
The accessibility...
And so is it something I could say that could indicate that I have a mental illness? Is it something, some of the words that come out of my mouth, if they don't come out correctly, that could indicate that I have a mental illness?
It's hard to speak in suppositions and absolutes, Craig. It's a combination of...
Because I think this was all based on personal bias and... My behavior? What was my behavior that indicated that I had a mental illness?
It was from what you shared with me. You became angry, you stormed out, slammed the door.
Well, people don't have the right to be angry?
They certainly do. But again, it's the full picture that I'm looking at when I'm doing assessments. So it wasn't any one thing. It's the full picture. But again, you have the right to decline treatment further.
And how come that nobody else can tell that I have a mental illness, only you? Like, what magical power do you have that can indicate that I have a mental illness that nobody else around me... Like, if I was to tell people I work with that I have a mental illness, I could lose my job. If you lock me up in the psych ward, I could lose my job. You must be right in your glory right now. Well, you're taking advantage of me. I feel like I've been molested by the psychiatric community.
I'm sorry that you've been feeling that way. Have other things happened that made you feel this way?
Have other things happened? No, just this.
Okay, so again, Craig, you have the right to...
My rights have been taken away.
No, you have every right.
Yeah, but then you could lock me up. I haven't even committed a crime.
Only if you get sick.
What crime have I committed that you have the right to lock me up?
You haven't committed any crimes. You were sick.
Oh, I'm sick.
No, you were sick.
Oh, I was sick.
So right now you're not having symptoms of psychosis.
Oh, I'm not?
But tell me.
And what's the difference between... How do you know that I'm not...
experiencing auditory or visual hallucinations?
I've never told you that I ever experienced auditory or visual hallucinations. I've never said that to you, so I don't know where you got that idea.
And have you been feeling that you're not a fully human being? Not fully a human?
I've never felt that way.
Okay.
I'm a human. I have rights. I was born with rights. I was born free. And my rights have been taken away from you, by you.
Okay. Do you feel you're being watched or monitored in terms of cameras being put up, satellites tracking you?
Well, you've called the police on me.
People following you on the street?
I've had the police called on me.
Yeah. So do you feel now
Like, why did you call the police on me to lock me up? And
Have you been feeling now that the police are following you?
I know you're following me. You got my name, you got my phone number, you got my address, you got all the information you need on me to keep me coming in to see you. So of course I'm being followed.
In what way am I following you?
You've got my phone number, you got my name, you got my information.
Okay, your employer has all that same information. So
Yeah,
how
but they're...
am I following you if your employer isn't?
Well, you've got nurses coming by my house.
So again, that's
You've got
just
me
a
coming
service
in to
you have.
meet you. You've got me coming in to meet with you all the time.
Again, those services are offered and meetings with me are offered based on your consent and capacity to
No,
choose.
I don't consent to this.
All right, well then you're welcome to leave. You don't have to stay here.
Yeah, but then you're just gonna lock me up.
No, I've got no reason to do
Yeah,
that.
you can call the police on me and put me in jail, and then I can lose both my jobs.
Craig, at this point, there's nothing you've shared with me that makes me think that there are symptoms to enforce a treatment.
What were the symptoms in the beginning? You never explained that to me. Yeah, and you used a bunch of big words. You used a bunch of big words that were invented by psychiatrists. Okay, they parked up the street. I went for a long walk just to get to my house, and they should be coming around the corner. Yeah, here they are. Oh, fuck. Mm. Hi.
You must be Craig.
Yes.
Hi, Craig. I'm Julie.
Hi.
Nice to meet you. We spoke on the phone.
Yeah, do
This
you
is
want to
my
come in
colleague,
or?
Kelly. Sure, if that's okay. Do you have any big dogs?
No.
Okay.
No, I'm kind of afraid of big dogs too.
Yeah. Yeah, well, thank you for seeing us.
Yeah, do you want to come in or have a seat or?
Well, why don't we come in if you're
Okay.
comfortable with that?
Okay. Like, I'm confused, I'm angry, I'm frustrated, depressed. You know, that I feel like my liberty and my freedoms have been taken away from me.
Okay.
And like, how would you like it if that happened to you? You know, like, I was locked up 3 times in the psych ward in 1 year, and it was like jail, and I never committed a crime.
Okay.
And the psychiatrist basically took one look at me and said, I'm diagnosing you with having psychosis. You know, and supposedly her evaluation is thorough and stuff, but I want to know what it was based on. I want to know what my symptoms were. It presented, like, I know you guys like to say that, you know, that you had symptoms that presented itself as a mental illness. Like, what does that even mean? Like, you know, like, what are these symptoms? I was never told that. I was never had a day in court. You know, I feel like I've been taken advantage of with unethical medical experimentation. You know, they're giving me medication. One of the effects is lowered libido. So they've taken away my sex life.
So you've got some great questions there, and lots of questions, which I love that you come prepared.
Do you want to hear some more? Or?
Okay, sure.
Like, like, my doctor said I was having hallucinations. Like, I was hearing and seeing things that weren't there. I don't even think that's possible, that people can hear and see things that aren't even there. Because you think, well, like, I never had my driver's license taken away from me. And, you know, when I was on the road, I wasn't, like, seeing things that weren't there. I'd be swerving and stopping and starting and stuff. I don't see any other drivers that are doing anything like that. So I think she just lied in her documents about me having hallucinations. I don't even think hallucinations are possible. Like hearing and seeing things that aren't there.
Well, from my
And what would her evidence be? Like, where's the evidence?
yeah, so from my education and experience, we do know that hallucinations are possible. Some people do have them.
How do you know they're possible? Because they tell you that they're having hallucinations?
That's right.
Well, they could be lying, though.
Well, but that's well, not everybody.
And you know, the other thing that psychiatry does is it says that mass murderers aren't responsible for their own actions and their own bad behavior. The psychiatrists say, well, psychiatrists are the only ones that can determine whether someone's sane or insane at the time of a committed murder. Not at the time of the trial, but at the time of the actual murder. And how is it that psychiatrists have a special gift where they can tell if people need medication or not? You know, it's all profit driven from big pharmaceutical companies. You know, there's just some things you just can't talk yourself out of. You know, like a mental illness. But I'm naming this video Exit Doctor because I want Doctor to exit my life instead of me having to exit my life. Like, she can take her medication that she wants to give me, and she knows what she can do with it. Hi.
Are you Craig?
Yeah.
Hi, I'm Thea.
Hi.
Is it okay if I come in?
Yeah, come on in.
Thank you. Oh, I like all your plants.
Thanks.
Oops. Where should I sit? Doesn't matter.
Do you want to sit there? Or?
Sit here, yeah.
Okay.
Here, I'm gonna move the chair just a little bit closer.
Okay.
And take off my jacket and stuff. It's cold out.
Yeah.
Alright. Is it okay if I take some notes while we're talking?
Yeah,
You
sure.
can always look at them if you want to. I just have a really bad memory. So I write everything down. Alright. So I'm Thea. I'm taking over as your mental health nurse, whatever you want to call me. I think you were last working with Julie?
Yes.
Maybe? Does that sound right?
Yep.
Yep. Okay. And then you met Kelly a few times. I think.
I don't know if I met Kelly, but
That's okay. You don't have to remember
yeah.
all of us.
Yeah, there's a lot of you.
There is, and we keep changing. But
Yeah.
hopefully you're going to be stuck with me for a little bit. So, how have you been?
Well, I've been kind of frustrated,
Hi.
angry.
Alright.
Feel like I've been taken advantage of.
Okay.
I mean, I've been given medicine without my consent.
Okay.
So, yeah, you know, I feel like I've been coerced into, you know, taking medicine that I don't want to take.
Are you talking about the injections?
Yeah.
Yes. Okay. Alright. Do the injections, how are they making you feel?
Well, just imagine being forced to do something that you didn't want to do, right?
Right.
You know, I feel like I've been molested, you know.
Oh, wow. That is not a good feeling.
No.
So it's not necessarily how the medication's making you feel that's upsetting. It's the fact that you're having to do it when you don't want to.
Yeah.
Okay. I'm really sorry about that. So you don't feel any benefit from, like, you're not like, oh, well, I feel like, I don't know, less symptoms or less something.
Well, I don't know what my symptoms were to begin with, you know. Like, I was never told, these are the symptoms that you have that
Is why we're
this
making
why
this.
yeah, exactly.
Okay.
I mean, um Dr. Bowden, diagnosed me with having a mental illness that
Do you know?
I never believed her in the first place,
Right. Do you know what she diagnosed you with?
Psychosis.
With schizophrenia. Yeah.
Well, yeah, whatever word you
Word you
want
want to
to
use?
use.
Yeah. Okay.
It's funny that nobody else can tell that I have schizophrenia. Well, she's never said schizophrenia. She said psychosis.
Yeah.
But either whatever word you want to
Yeah.
use, it's just I believe it to be made up.
Okay.
Because if nobody else but a psychiatrist can tell that I have
Yeah.
psychosis, then how do I have it?
No, that makes sense. Sorry, I'm just writing down
Yeah,
what you
no,
said.
take your time.
Alright. But you're still coming in for your injections, which is great.
Well, if I don't,
Yeah, you
I'm
get
gonna
in
be
trouble.
locked up, and I'd have to pace the hallways at a psych ward,
Yeah.
which is like jail,
Yes, it
and
is.
I've never even committed a crime.
These are really valid feelings. Yeah. I'm sorry you feel that way, though. That
Well,
sucks.
I mean, how would you feel?
I would probably feel the same way. Yeah, that's what I mean. I think they're valid. Makes sense. I mean, unfortunately, there's nothing I can do, right? But
Well, you
except
could
to sort of.
speak out against psychiatry.
Well, I mean, I do believe in mental illness, though, but I don't believe in the way we
But
treat.
how is it that only a psychiatrist can tell if someone has a mental illness or not? Nobody else can.
Well, they can. They just can't
Like,
diagnose
and
them.
if I tell people at my work, I could
Yeah.
lose my job.
See, that is where I'm like, that's BS. Like, you shouldn't be able to lose your job if you're mentally
Yeah, but
ill.
there's a
There's a stigma.
like when you label somebody
Yeah.
as having a mental illness, it ruins their life.
Exactly. But it shouldn't. That's where I'm like, that's where I think things need to change in our society and our system. Because it shouldn't be. So many people are living with mental
Well,
illness and functioning with it and taking their medication and are fine. It shouldn't have what you're saying, where it's this stigma.
like over the years, humanitarians have come forward and said no to straitjackets,
Yep.
lobotomies.
Yep.
Um, they used to wrap patients up in wet blankets.
Cold
They have
towels. Yeah. Horrible.
Seclusion,
Yep.
restraints.
Yep.
When are they gonna come forward and say, you know what, psychiatry is just like there's never been any proof that any of these people have ever had a mental illness. There's no proof. There's no evidence. You can't be detected with a blood test. It can't be detected with a brain scan.
Yeah. No, it is a
It's
very
just it's
gray
like I think it
area.
was all based on personal opinion and bias.
Yeah. I mean, they're good points. And, dude, I could talk with you about this for hours because I find it very interesting. The same things you're saying. When do we decide that a behavior has gone from
And like, what was it? Was
acceptable
it
to
something
normal?
I said? Like, was it something I said? Because if there's such thing as freedom of speech, I should be able to say whatever I want to say, without being persecuted for it, as long as it's not threatening towards anybody, and it never was.
Yeah.
So, I don't think psychiatrists believe in freedom of speech.
You're raising really valid points. You
I
are.
mean, I think about this stuff every day.
Yeah.
Like if you talk to Julie, I pretty much brought up all the same stuff with her.
Exactly. Her notes. Yeah. Yeah. I mean, all I can say is I think you're making valid points. I'm gonna say honestly, I think about the same thing in a different way. I think for me, the question is more, okay, at what point do we say that a behavior or comment somebody is making need to be deemed unhealthy versus kind of what you're saying? It's
Yeah,
just,
it's
it's
like
personality.
the
It's people are being people, and where is that line? And it's an interesting line.
well, there is no.
When
I don't think there is even a
a
line. I think
line,
you should be able to say whatever you want to say.
yeah,
You know, if I want to say I'm a hard-boiled egg or whatever, like
yeah,
I should have the right to say that. Like
yeah,
I'm not, but I never said anything like that. I never
yeah.
said to the doctor that I was having hallucinations. She just said to me that you were having hallucinations.
So you don't believe that you ever had hallucinations?
Well, hallucinations, from my understanding, is hearing and seeing things that aren't actually there.
Yes, that's correct.
Um, how was I able to keep my driver's license if I was hearing and seeing things that weren't there?
Well, I think the way hallucinations can present varies, right? When I've talked to other people I've worked with who have schizophrenia, and they'll tell me about what their hallucinations are.
How do you
Some,
know they're telling you the truth, though? You
you gotta
know?
take a leap of faith, yeah.
And the whole thing about taking a leap of faith is you're taking a giant leap,
True,
you know?
true. I know. But it's the same. I could turn that around though and say the same thing for you. How do I know when you're saying, "Oh, I'm not having any hallucinations. I'm not hearing anything. It's all in your head."
Okay,
Right?
well,
I
let's
have
do
to
an
believe you.
experiment. Let's do
Yeah.
an
All right.
experiment.
Go for it.
Okay, let's just be quiet for a minute and
Mhm.
see if we hear anything. I hear the dryer.
Mhm.
I don't hear anything
I
else.
don't hear anything else either. No, I don't think you're
So,
hearing anything.
and I don't even think hallucinations are even possible. Like, if you were like, the whole point of animals and like how we're related to other animals and stuff is if you hear anything in the wild, you hear a rustling in the bushes or something
Yeah.
like that.
Yeah.
You know there's something there,
Yeah.
and you know to protect yourself from it, and you know whether to run away or not.
Yeah.
If people were hearing and seeing things that weren't actually there, well, like, yeah, they'd be talking to a lamp post or something like that. But there's other explanations as to why they might be talking to a lamp post. They might not have anybody else to talk to.
Mhm.
Maybe nobody wants to be friends with them or something. Or maybe they're just trying to get a reaction out of somebody else.
That's an interesting one.
But I've never experienced hallucinations, but the doctor said that I did.
Okay.
So what am I gonna do? Tell the doctor that she lied about in her documents about me?
No, and that's again where psychiatry gets very gray because it's her perception, right? And that's what she's documenting, and that's why you can see multiple psychiatrists and get multiple diagnoses, which is
Well,
an
they
issue.
all they all work together too to
Yeah,
back each other up.
sometimes, yes.
Um,
Yeah.
and everybody I've talked to says, well, you're just gonna have to talk to Dr. Bowden about this. But I mean, when Dr. Bowden diagnosed me with having psychosis, I got up and I said, "This is ridiculous. This is outrageous. I mean, I can't believe what I'm hearing here." And I left the meeting and I said, "I won't stand for this. I don't need your help. I don't need your treatment,
Mm.
and I don't have any mental illness." And I left and I went home, and 15 minutes later, the police knocked on my door, handcuffed me, came right into my house.
Wow.
Yeah, they opened the door. I didn't even open it for them.
Yeah.
They walked into my house, handcuffed me, put me in the psych ward where they gave me all sorts of drugs. Medication,
That
if you
actually
want
sounds
to call
quite
it.
traumatic.
Yeah, it was very
Yeah.
traumatic. And then I was spent 2 weeks in the psych ward pacing the hallways.
Do you know what? Did anyone ever tell you what it was that prompted you to be brought in? Like what you were doing or behaviors, anything like that? That led
I
to.
wouldn't even know
You
what
wouldn't even know.
what possibly could
Okay.
get a person in a situation like the one I'm in.
Okay.
But I
Okay.
feel like I've been treated like a criminal.
Okay.
You know, I got locked up 3 times in the psych ward in 1 year. And I hated every second of it. And the people that I met in the psych ward, I thought were the most normal people I've met in a long time.
Yeah.
And I think it's just a huge waste of resources.
Yeah.
I think it's profit driven by the pharmaceutical companies that want to sell these antipsychotic drugs
Yeah.
at a high cost to the taxpayers.
Yeah. Yeah. Well, can I deviate? I hear what you're saying, and we could just keep going on about this for a while because it's an interesting topic.
Well, yeah. Sorry, go ahead.
No, it's okay. There's a couple things, and I'm only doing this because I do have, limited time. We've got plenty of time, but I just want to, because I'm just taking over here and getting to know you. There's a couple sort of things I want to tick box. That makes
Okay.
sense.
Yeah.
Are you married?
Yeah.
Okay.
We're kind of separated though.
You're kind of separated.
Yeah.
I have her listed as a contact for you. Is that still somebody I could reach out to if, say, I couldn't reach you or you ended
Yeah,
up in the
and
hospital? Is that still okay for me? Her name's Rena?
yeah, it's funny that you brought that up too. Yeah, because Dr. Bowden said to me one time that based on she interviewed my wife and at the time, and she said based on what my wife has told me about you, I'm diagnosing you with psychosis.
Ah.
So my wife has freedom of speech as well. She can
Yeah.
say whatever she wants about me.
Okay.
And you know, one person shouldn't be able to say something about another person
Okay.
that gets them into a lifelong condition where they have this lifelong mental illness.
Yeah.
You know, and there's no.
Is this what's prompted you guys to
I gotta say
separate?
I gotta say, well, partly,
Okay.
but I gotta say you're actually a lot better listener than Julie. She like basically said, okay, well that's a question for Dr. Bowden. That's not a question for me. I'm not an expert on the subject, so I'm not gonna like even entertain these questions. But I was, yeah, I was grilling them pretty hard.
No, I think these are great questions, honestly. And like I said, I could sit and talk to you about it for hours because there are things working in this field I think about quite a lot, to be honest. I think about them with a slightly different angle.
Yeah, like the history of psychiatry,
It's
like
fascinating
it,
and
like
horrific.
yeah, like when you look at like lobotomies,
Oh my
they would
God, yeah.
cut out a piece of the person's brain.
Oh, it was,
And the
it was
medical
fucked up.
community, yeah, the
Yeah.
medical community like completely frowned on it. And the weird thing
Yeah.
was the person that invented the lobotomy won the Nobel Peace Prize.
Yeah.
And they were giving lobotomies to patients that didn't want them.
No, and a lot of them who didn't need them. Yeah.
Yeah, well, I don't think anybody needs any of these antipsychotic drugs. I don't.
Yeah.
There's a book called The Myth of Mental Illness by Thomas Zass,
Okay.
and he says that there's no such thing as mental illness.
Yeah.
It was just invented by these words like schizophrenic, psychosis, and stuff. They're all invented by psychiatrists.
Well, and you
And
can
he was
also,
he was a psychiatrist.
you can also look at different cultures, and you look into some indigenous cultures, and people who were hearing voices and seeing things were shamans. They
Yeah,
were considered connected to another plane,
yeah.
and were who people would go to in those cultures for advice. And so it's a very interesting.
And I feel like it's just every time she asks me if I'm
Dr. Bowden.
Dr. Bowden,
Dr. Bowden, okay.
every time she asks me if I'm hearing voices,
Yeah.
I feel like it's just a slap in the face question, you know?
Yeah.
Like I'm hearing your voice right now. Like if you were to ask me if you're hearing voices, I'm like, well, I'm hearing your voice, but am I hearing voices that aren't actually there? No. No, I'm not. I never have. So I don't know where she's going with this. And then another slap in the face question is that when she asks me if I have any feelings of harming myself or anybody else around me. And I feel like saying, is that what you think of me? Like, is that you think I'm going to harm myself? She's never asked me if I've have attempted to commit suicide. She's never asked me that once.
Have you?
No.
Okay. Because I actually have to ask you that, and I can tell you why we all ask you those horrible.
Well, it's
insulting
it's
questions.
because you're intervening in my life to save me from myself.
To an extent, yeah, you're right. Yeah, that is what we're doing. Yeah.
And but there's never been any proof that I've ever wanted to harm.
No.
I don't have any assault charges on me.
No.
I've never had any assault charges on me. I've never attempted suicide.
Yeah.
So where does she get this idea that I would want to harm myself or anybody else around me?
There's absolutely nothing personal when we ask that question.
Yeah, but it makes me think, well,
know.
this is what you think of me. This is what you this is how you think of me, right?
Yeah.
And it makes me think, why do you think
Think
this
that
of
about
me? Yeah.
Yeah. No, which is valid, but what I will say, the reason, and this is why I say don't take that question personally. That is
Well-
a question that we as healthcare providers have to ask.
Well, do you know why?
Everybody.
Do you know why? Is because there's a link between suicides and people who are under these interventions by the mental health department. Because how would you like it if you were followed around by the mental health department for the rest of your life, constantly having to have meetings with people like yourself, constantly be having to go in and get medication, like, you know who Kurt Cobain is?
Oh, fuck yeah, I do. Yeah, come on now. Yes.
Well, look, he's an example of like a casualty of the mental health department. Like, he was just before he killed himself, he escaped. He climbed the wall at a treatment center and escaped a treatment center. So don't you think it was the treatment center that had some sort of fault in him killing himself?
You're asking the what came first, the chicken or the egg question.
Because but if you've got like when someone says to you like we're here to help you,
Yeah.
okay, how do you free yourself from these people that are constantly checking on you, connecting with you and stuff like that? There's only one way, and it's suicide. If you it's the only way to free yourself, because you're stuck with this lifelong mental illness where you've got all these people from the government that are coming to try to help you and intervene, but they're giving you medicine you don't want to take.
Yeah.
They're constantly meeting up with you, and you feel like you're being harassed, you feel like you're being bullied, and you feel like you're being stalked.
So I guess, and those, I get what you're saying. I think the difference where I would say, when you ask how would I feel about that, the question is, do I believe that I have a mental illness, right? So if I knew that there was something going on with my brain that I needed help managing so that I could function, I wouldn't mind it. If, however, I was like, no, I'm totally fine, there's nothing wrong with me, I don't need this, then I would be super pissed off.
Yeah. Can I give you another example of
Go
someone
for it.
else who killed himself? Ernest Hemingway.
Did he?
He killed himself after electroshock therapy.
I did not know that.
Yeah.
But I did know he killed himself.
Yeah, if you look it up on Wikipedia,
I,
he was getting electroshock therapy
Yeah.
and he ended up killing himself after it.
it's
And that
very
was an
horrific about
intervention by psychiatrists.
that. Yeah. No, I mean,
And if you look at the stats, the people that do kill themselves or have drug overdoses and stuff, they're all almost, well, not all of them, but the great majority of them are when they're under the care of the Mental Health Act.
Yeah. I mean, all I can say is it's that sort of debate of what came first, the chicken or the egg, right?
I mean,
Did this
I like,
happen
I kind of,
because
I get,
they were mentally ill, or did it happen
no, it's
because we
because
were
of the harassment, it's the constant,
harassing?
um, like the phone calls, the meetings,
Yeah.
the forcement, like, and also if someone labels you as having a mental illness,
Mm-hmm.
wouldn't that make it like hard for you to live as a person with a mental illness? Wouldn't you want to kill yourself? You've been told by a doctor that you have a mental illness.
Depends on how you view mental illness, right? Like I've worked with some people who have been diagnosed with schizophrenia, and they go, "Oh my God, this makes things make so much sense." And they talk about the things that they're seeing that aren't there, and they know that they're not there, and they actually really appreciate it. Then there's people like you, and you're not alone, who are going, "No, this is bullshit, this is invasive, I don't like this."
Mm,
Like there's both. And so then
yeah.
you go, okay, so then me as a professional, I go, okay, well, I don't want to be doing harm anywhere, right? Like my intent
Yeah.
is to help. And
Like
then
if I
what
was
do you
to,
do with people who fall into your category, who are like,
yeah,
no, fuck off,
yeah.
you're harassing me?
Yeah, like nobody's forcing me to take insulin. I'm a diabetic
Right.
and I take insulin, and if I didn't take insulin,
Mm-hmm.
it would be really damaging to my blood vessels.
Yeah.
And I could have an early stroke or heart attack or
Yeah. All
something like
kinds of
that.
things. Yeah.
But nobody's forcing me to take insulin. If I want, I could just not take insulin if I wanted to kill myself.
Yeah.
But yet people are forcing me to take these antipsychotic medications. And it's like, do I not? Where's my right to refuse to
Mm-hmm.
take this? Like, I should have the right to refuse, you know?
I think the line becomes, and this is going to go back to another point you made earlier that was quite good, but I think the line becomes if you don't take your insulin, the only person who's possibly harmed by that is you,
Yeah,
right?
yeah.
However, if you have, and I'm not going to say you have schizophrenia, but if you have somebody with schizophrenia, hold on, let
I
me
don't
finish
think
my
it.
thought.
Okay,
Okay,
yeah.
because I'm saying this isn't
Okay.
like, I'm talking
Yeah, I'm
hypothetically
just
here,
I
I'm
I
saying like,
honestly
where's the
think
line?
that
The
there's no such
line,
thing as
okay,
schizophrenia. I
okay,
think it
hold
was
on.
like made up.
Okay, so I'm going to politely disagree with you on that because I think
Okay.
there are people who do, for whatever reason, and we don't
But
understand it,
how come
hear into things.
only a psychiatrist can tell if somebody has schizophrenia?
Well,
What
that's not
magical power
true.
does she
They
have, or
don't.
do they have?
They don't. They don't have a magical power. But some people who have schizophrenia even know that they have schizophrenia, right?
Well, they've been told they have schizophrenia.
Yes, but they are able to say that I'm seeing something that I know other people aren't seeing, right? They're able to say, like, I had one gentleman who I worked with who had schizophrenia. He knew he had schizophrenia because he would
And
see
what were the characteristics of it? Like
he
how
could see
how does
cats
he?
places. He would see cats falling out of the sky. Hi. He would see cats jumping around. He would see cats coming out of like cloud. He would describe to us what he was seeing. That like right now, this is what he would tell me. Pretend you're me and I'm him. This gentleman
See,
who
this
knew.
is embarrassing to me because that's my renter downstairs, but that's okay. Go on.
I'm so sorry.
Yeah, like it's like a dirty little secret, right?
Oh, I'm so sorry.
No, it's
She had
okay.
earbuds in.
She thinks I've got a girlfriend or something.
Oh.
Anyways, go ahead.
Okay, I'm
But
sorry.
the thing is, like,
No, this was
okay,
so he would say, okay, behind you right now, like turn around and look behind you. What do you see?
a painted wood wall.
Yes. So he would say to me, I see a cloud of fire above your head, and cats are falling out of it right now. And they're falling onto the sofa, they're falling onto you. And I would go, I'm sitting here right now. I don't see any, like, there's no cats on me. There's no
Yeah,
cats falling on me. And so it wasn't
I could say, you know
opposed
what? I
to
could say,
reality, but
I could say the same thing if I wanted to. If I wanted to have a little fun with you.
You could, but here's the difference. He would then say when he took his medications, there were less cats. Or the cats will go away completely. And he didn't like seeing the cats because it was obviously
Yeah, but
quite
how would you
stressful.
know if it was the medication that was getting him to not see cats?
Because he
Or,
was
because, like,
healthy
how,
after he took
what
his
if,
medication.
because they never did a test to see whether he was not seeing cats, like,
We looked
when he
into
wasn't
it.
taking his medication, right?
No, we did because when I started working with him, he wasn't on medication yet, and he could see the cats. And then he started taking medications, and the cats went away, and the clouds of fire went away. And so
It's because,
that was,
you
and he was able to
can convince people of really almost anything if you tell them, and if it comes from a doctor, it carries a
true.
lot of weight.
That's true.
And these pharmaceutical companies are, like, if they were able to find the exact molecular chemicals
Mm-hmm.
that could change you from not seeing
Yeah,
cats, that would be probably the greatest discovery in medical history.
that's true. It would be if we could pinpoint your.
And
You're
I
right.
don't believe it. I don't believe it for one
And
second.
you're right, and that's
Yeah.
okay. And I know I'm never going to be able to convince you otherwise, and that's okay. So what I can do is try and limit how much I harass
Like, I
you.
want psychiatry to be abolished. Like,
That's
I
fair.
think that
That's
we,
fair.
like, throughout the years, all the barbaric treatments in psychiatry have put an end to it because people were just like, no, that's just nonsense. The whole thing is nonsense. Like this, like, just because you have a master's degree in psychiatry
Yeah.
or whatever, it goes sort of straight to people's heads, and they think they can just, I don't know if they're getting kickbacks from the drug companies
Or
or
it's just a
what,
power trip.
or it's just a power trip. Um, but they're just diagnosing people, over-diagnosing
Yeah.
people. Well, not just over-diagnose. I think the whole thing is an over-diagnosis.
Yeah.
And I think it belongs in the past, a dark, dark
Yeah.
past. That people would be better off for just completely forgetting about, because it ruins people's lives. Like, it's like, like, just being like, like, if I was to wear a shirt that said, one of these words on it,
Schizophrenic.
yeah, or
Yeah.
whatever. Like, do you think I would make more friends or less friends?
Less. There's
Yeah,
huge stigma.
exactly.
There is. All
And
right.
I think the medical community really is embarrassed by psychiatry. Like, I mean,
Like embarrassed of our history, or.
just, I don't, I think, like, people who actually work in the hospital
Mm-hmm.
that actually treat injuries
Yeah.
and actual real illnesses that can be detected through a, like, MRI or a
Yeah.
brain
Yeah.
scan or something like that. I mean, they must, I don't know what they think of psychiatry, but I can tell you what I think of it, and
But you have
it's,
been very
yeah.
articulately.
Thank you.
Yes. All right. So again, I'm going to pivot a little bit just because of time, and I know you could keep talking about this for a while, and so could I. But so I don't want you to feel harassed by me. I don't want you. I don't want those feelings for you. That
Mm.
sucks. But I also have to do my job. So I do have to check on you occasionally. And
You're like my babysitter.
I am like your
You're
babysitter who's getting.
treating me like a baby.
Well, no, I'm not. I
Well,
don't.
no, it's not. When I say you, I mean your whole, or this whole psychiatric
Community.
community. Yeah.
That's not our goal, is all I can say. The goal is more to.
So I don't hang myself from a tree. Well,
Well,
how?
no, not that. No, no, that wasn't. I was gonna say to make sure you are having a fulfilling and functioning and rewarding life. but I know you're gonna tell me that I'm preventing you from doing that.
Thank
So
you.
that's why I
Thank
paused,
you.
because I was like, oh,
Like you're a good, yeah,
nobody's
you're
gonna come back to me
definitely,
with that one.
you're, I'm getting my point across. That's
Oh no, you are, and I don't think that your points are all bad. I don't agree with all of them, but that's okay. We're humans. We don't have to agree with each other on
like
everything.
when Kurt Cobain offed himself,
Yes.
he had flown from Los Angeles to Seattle,
Yeah.
and he went to Seattle and he bought a gun, and then he ended up shooting himself. But he climbed the wall at a treatment center.
Yeah.
If I was in the psych ward and I climbed the wall and escaped, I would have the police would be looking for me. The doctors would be looking. Everybody would be looking for me, and not in a good way.
No.
So don't you think that is what helped contribute to Kurt Cobain's suicide?
Politely, I don't. But again, that's just difference of opinion.
Like, why else would he kill himself? He had, like, he was, one of the, top musicians in one of the top bands.
I think, and we'll never know, but I'm gonna
Like,
give.
and if he climbed the wall at the treatment center and escaped it, it means they weren't gonna let him out.
Yep.
It means he did it. He did it to escape.
Yep.
And he was under the same sort of treatment that I was under.
Yep.
When I was locked up in a psych ward, and nobody wants to pace the hallways
No, it sounds
locked up. This has been going on since the old lunatic asylums, the old insane asylums.
Well, we have come a long way from that, at least.
There's actually a documentary that you should look up. It's called If These Walls Could Talk.
I have seen it, and it is brilliant.
Yeah.
Yeah. Yep.
Of the Toronto Insane Asylum.
Okay. Yep.
Yeah.
Yep. No.
I don't think they went far enough, though. I don't think they got to the conclusion that this needs to all be put to an end,
Well, they did put a lot of the traditional, like.
It was stories, it was stories from patients who were inhabited there, right?
Yeah.
Yeah.
All right. Well.
But thanks for listening, though.
You're very welcome. Would it be too much if I just gave you a call like every 2 months, 3 months, something like that, just to say, hey, how you doing?
You gotta do your job,
Alright? But I don't want you to feel like you're being babysat. That's a horrible feeling.
Yeah, I mean, I gotta see Dr. Bowden on the 15th or 16th.
Yeah.
Yeah, it's just like I would I would like to be free of all of it, I feel like my freedoms have been taken away from me. My liberty has been taken away from me. I just, like
So you don't
feel
like you
like
get any benefits from like us checking in with you, us being like me, Julie, any of them checking in with you every couple of months. It's just being like it's surveillance to you, yeah?
I don't need a babysitter.
Yeah. Okay. Are you still? And I hear you. I thought
Yeah.
that wasn't a dismissive, yeah.
Yeah.
Are you still working close to full time?
Yeah, I got 2 jobs.
Oh, okay. What are they?
One is at KFC.
Okay.
One's at the Superstore.
And Superstore. Not Superstore. Superstore.
Yeah, stupid store.
Yeah, same thing.
Yeah.
Okay. And so are you on, do you get PDW, persons with disabilities, or are you paying for?
No, you think that with all this, I should be on disability or something because I have a mental illness, right?
But you're not.
Like I was gonna ask Dr. Bowden. No, I'm not. I was gonna ask Dr. Bowden why I'm allowed to vote. Like I have a mental illness.
Why am I, that's actually,
Why am I allowed to drive a car? I'm seeing and hearing things that aren't there. Supposedly, I'm not. Like I've never admitted to that, and I've never told Dr. Bowden that I was hearing and seeing things that weren't there.
And you
But
firmly believe that you never were hearing or seeing things that weren't there?
never.
Never. Okay.
I mean,
Can I
I've
ask you a
tried. I've
question?
like tried to hear things. I've tried to see things. But I see my neighbor walking down the street. I don't know if he's actually walking down. It's making me second guess myself. I don't know if of course he's walking down the street because you know why? I can see him,
Do
and
you know
seeing
what
is
it was
believing,
that your
right?
wife said to Dr. Bowden when Dr. Bowden said after he
That's a
you?
great question. Well, she told me.
Yeah.
And I don't know if this is true or not. She might just be playing a joke on me or
Never know if
whatever.
it's true or not,
But
do
she
we?
told me that I told her that I said that Cleopatra was coming back to kill me.
And you don't remember that?
I've never said it. You damn right I don't remember saying anything so outrageous.
Okay.
But that actually,
Cleopatra is coming back to kill me?
well,
Or is, yeah.
was like, well, yeah, is, I guess I said that at the time. Um, but yeah, that could be something that a psychiatrist could say, maybe think that I've got some mental illness if I said something so crazy like that. But I never said that, and I was like, honey, why did you say that? Like, what? Why would you? And I don't know. Maybe if she did it as a joke. Um,
Pretty cruel,
but yeah, anybody could. But it just shows that she's allowed to say whatever she wants about me because of freedom of speech, right? It
Okay.
doesn't, like,
But
I don't know if Dr.
you
Bowden took into
agree
account
that
that
would be a wild thing for somebody to say if they meant it.
if they meant it,
Patrick is coming back to yeah, like somebody said that and they didn't say it as a joke. Would you be like, damn man? Okay.
yeah, you're making a good case for mental illness in that case.
Right? But you don't remember ever saying that.
Well, it's not that I don't remember
You're
saying it.
pretty sure you never said it.
I'm guaranteed I didn't say anything like that.
Okay.
I'm trying to keep everything I say, and I'm like carefully watching every word that I say now because I don't want it to get like interpreted as a mental illness.
I see. Okay. Alright.
But no, I never said that, and the fact that my wife said that or whatever, like I don't know why. Maybe she wanted me to get committed to a psych ward. Maybe she want.
Or someone could say maybe she was the crazy one. Right? Maybe she was hearing things.
Well, I think
So
that
subjective.
psychiatrists have to take into account when people could be lying about another person,
Yep.
and they need to take into account people that are lying about hearing and seeing things that aren't actually there.
This is true. But I would say that's true.
Because
in every single
but nobody
situation.
knows. Like I don't know if you're hearing or seeing things that aren't actually there. I can't magically go inside your body from your point of view,
Yeah.
see what and hear what you're seeing and hearing, right?
No.
So I have to just take your word for it, right?
We all do.
But you could be playing games with me and start having a little fun with me and start saying, I'm seeing Santa Claus and the Easter
Right.
Bunny and
I could start pretending to have a conversation with the plants and tell
Yeah.
you that you're nuts because why can't you see that
Yeah.
plant's talking to me? No, you're
Yeah.
absolutely right. It's true.
Yeah,
Reality
nobody
is-
knows what someone else is thinking.
It's true.
Nobody knows if someone else is going to commit a crime in the future.
Yeah.
Nobody knows if a person is going to harm themselves or harm anybody else. So I think it's like, I don't think we should presume to think that, like, assume that we can tell what's going on in somebody else's head because we can't.
No, you're right. And reality is a very fickle, strange thing because nobody knows what somebody else's
Well,
reality
like
is.
psychosis, the definition of psychosis is when someone's totally out of touch with reality.
Yeah.
What does that even mean, though?
This is true that they're not in touch with the agreed upon version of reality. That's
Like
how I
I'm
would
totally
define
out
it.
of touch with reality.
Yeah.
Really? Is that like that doesn't even make sense though. It's like we all live in the real world. I wish the real world would stop pushing me around. To quote Matchbox 20.
Yeah. Dude, I think you need to read some philosophers because they battle with the same question, right? If you've ever
Yeah,
gone into
well,
philosophy and like the whole what is real? How can you say what's real? How do we come to an agreement as a species that this is the reality? That the sky is blue and not orange? Whoever decided that and agreed on that, and then what was it, just majority
and
rules?
even if someone was to
You
see
know?
the sky as orange, they would learn it as blue. They would learn
So
that
how would
color
they
is
know that it
blue.
wasn't? Ooh, that's a good one there too.
Yeah.
Yeah. Okay. All right, my dear. So, um, you're still working. You're sort of separated from Rena,
Yeah,
but
she's
it's
living at another house.
okay. But it's still okay for me to reach out and contact her if I needed to for some reason.
If she tells me that that I said that Cleopatra's coming back, just don't believe her, okay?
Okay.
She's
Okay.
But you know what? It doesn't matter. It doesn't matter. What's done is done. I've
Right.
already been diagnosed with psychosis. So I might as well just start
Yeah,
saying
it's
crazy things. I might
well,
as well
hang on a
start
sec, Craig.
saying crazy
Hold on. Let
things,
me
you
interrupt
know?
you because you do know they can take away diagnoses. It's not like once you have it forever, like
Well,
diabetes.
she never proved to me that I had a mental illness in the
Right, but
first
you can
place, you
go
know?
see a different doctor, and that doctor might say, "No, I disagree with this doctor, and you're actually fine." So it's not that you always have that
Well,
diagnosis.
I think not only did she misdiagnose me, I
Oh,
think she's misdiagnosing everybody.
yeah.
And
So
I
just to put that out there, that it's not like it's a
I don't
diagnosis that's
believe,
grounded
yeah,
on you forever.
I don't believe that people have mental illness. I
No,
like
I find that.
I don't I think I believe in if you look up Thomas Sass
Okay.
on YouTube and stuff, he's passed away now, but he's got some YouTube videos where
I
where it's
avoid
just
anybody who makes YouTube videos. Just what's the
yeah.
point of?
Well, his book The Myth of Mental Illness is a good book.
All right. Is there anybody else that you would be comfortable with me reaching out to or checking in with if, say, for some reason, like I said, I couldn't get a hold of you or I started to get worried, like, oh, is this kind of weird? Let me check in if anybody else thinks so. You know,
I don't think there's anything to worry about. I mean,
I
like,
think you seem pretty solid right now. I'm not too
mm,
worried.
like, I mean, all those, there's, most people don't have a babysitter, right?
No, they don't.
Especially at my age.
No, I can get why it feels insulting.
Yeah. Well, I'm glad that you're, like, listening and thinking about this kind of stuff, but,
It's fascinating.
I just need more people to speak out against psychiatry, and I just hope that, it's just, I needs to
Well,
be put an end to, like,
I can speak out against it. I differ with you on that, but I think the way we view it and treat people with mental illness needs to be completely changed and overhauled. Because I do
I've
believe in
never
mental
met any,
illness,
but
but I
I've
don't
I've
believe.
never met anybody with mental illness. Even
No.
Britney Spears, I don't think is mentally ill.
What if I said I have mental illness?
I've been talking to you, and I think there's nothing wrong with you.
Oh, thanks.
Yeah.
Um, no, but see, I would say I had a mental illness if somebody asked me. I would.
Well, maybe you're
Not
saying that just to
schizophrenic.
get sympathy, maybe.
No, I know my brain does quirky, fun, weird things.
Everybody says so. That's
That's
natural.
true, and that's where then that question of when does quirky, weird brains become a mental illness versus, okay, it's just another quirky, weird brain, right? That line is
That's
what is
because
fascinating, right?
it's because there is no mental illness. That's the whole bottom line.
I see what you're saying.
The bottom line
Everybody's
is,
brain is quirky and weird, and that's the normal.
yeah,
I hear you.
yeah,
Okay, I hear what you're saying. I
yeah.
hear what you're saying.
Like,
Okay.
everybody puts their pants on one leg at a time.
Yes, they do. I hear what you're saying, man. All right. I have got to go here pretty
Okay.
soon. But I'm gonna give you a call if you're cool with it. Probably like every 2 months, and just say,
Yeah.
hey, how you doing?
Yeah, you're easy to talk to, Thea.
Thank
Yeah.
you. You are very interesting to talk to. Lots of things to
Mm,
ponder over.
thanks.
No, it's okay. This is what I like thinking about. This is why I
Yeah.
do what I do because I think it's interesting. I think how our
Yeah.
brains work is interesting. I think how we perceive reality and what, as a society, we consider acceptable and not acceptable is
Yeah.
interesting.
Yeah.
And I think how we treat it, in a lot of cases, to be blunt, is really fucked up. So I don't disagree with you on everything, but I don't agree with you on everything either.
Okay.
You know?
That's fair.
That's fair. Freedom of speech, right? We
Yeah.
can agree on some and not on others.
Yeah.
Yeah.
I think we agree on more than
Disagree.
you disagree, yeah.
I think yeah. And then we take some big.
Cause like when you were saying like when I was basically saying that psychiatry was bullshit or whatever, you took the words right out of my mouth. You were like, I get what you're saying. You're like, you think this is bullshit, and I'm like,
Well, I don't think it's
yeah.
bullshit. I don't think it's bullshit, but I don't think it's. I think it's missing a lot of important pieces.
Like
Not missing important
how
questions.
is a psychiatrist able to tell if someone has a mental illness and nobody else can? Don't you
See, that I
see?
don't
Don't
agree
you
with you
see?
because I think other people we do, and that's where a psychiatrist usually can't diagnose somebody unless they have what we call collateral, which means kind of like what your wife said. All right, but you're gonna keep coming in for your injections, yeah?
Well, I don't want. I have to.
You have to.
I've been coerced into it.
Yes.
Should be against the law what's happening to me.
Yeah.
You know, being forced to take drugs or else get locked up.
Yeah. Again, it's an interesting debate. It is. When do you get to say, for the good of the society as a whole, we're going to intervene and impinge on this person's rights?
Yeah.
You know, when do you get to say this person is a danger to society as a whole?
Especially when they haven't even committed a crime.
Yeah, that's a valid point.
You know, I can understand if like I had a
gray.
if I had a arrest record, if I had like a history of assaults on myself or other people, but there's nothing.
Yeah.
So yeah, it doesn't jive with me.
No. But I really appreciate that even though it doesn't jive with you, you're still willing to come in and take your meds and do the things we're asking you to do. And
Well,
I really appreciate that.
I don't want to go to jail.
Yeah. Yeah. I mean,
It's like
it's sad
it's
that
an
that's the
awful
only
life
thing.
that I've been given from the psychiatrist.
Yeah. When were you when did all this start for you? I didn't read. I purposefully don't read way back into people's charts before I meet them, just because I like to go in, clean slate
Yeah,
and form my own opinion. But when was that you? When did this all start for you?
like about 3 years ago.
It was 3 years ago. Okay. And you haven't been in since that 3 years ago when you went in 3 times.
Yeah,
Okay.
because I've been taking my medication.
Okay. Okay. All right.
Yeah, I think I've pretty much said all I needed to say, but
Okay.
I don't know, like, at least we have something to talk about, right?
Yeah, we got lots to talk about, man. We're gonna have some interesting conversations every 2 months.
Yeah,
Yeah.
but I mean, yeah, it's just every bone in my body
Yeah.
wants to fight against this.
Well, at least we can take away your right to vote, so you can vote for things that
Well,
fight
I think it
against
just proves that there is no mental illness to begin with. If I'm still allowed to vote, if I'm still allowed to drive a car, if I'm still allowed to go out in public and, like, go into a supermarket or whatever, like I've never done anything. So what makes them think that I'm gonna do something bad? Like, what am I gonna do? Kick a puppy or something?
hope not.
Mm.
Poor puppy. No, I think, see, the argument we would make is you can have a mental illness, right? I think where you're getting stuck is on the stigma that we've attached to mental illness. Because I would say, okay, somebody can have a mental illness, they can have schizophrenia, but they can drive, they can hold down a job, they're not a danger to society. They are functioning, they're doing great. They have this illness, we know that. We know that
But
sometimes
what is
they're...
it? Like, this is what I'm going to ask Dr.
Okay.
Bowden. What is this illness? What does it look like? What is it? What is it? What like describe it to me. How do I
Okay.
differ from somebody who doesn't have a mental illness?
Have you ever Googled schizophrenia?
Yeah.
And you've read what it is that a schizophrenic, what they have to present like to get that label,
Yeah.
and you don't feel any connection to
I
any
feel
of
like it's bullshit.
Okay. Fair.
Yeah.
Valid.
Yeah.
Okay.
Yeah, I've read all about hallucinations.
Yeah.
I've read about schizophrenia.
You're like,
I've read about psychosis.
this
It's
doesn't
just an
resonate with me.
invention by psychiatrists. Yeah.
Okay.
Like I don't now
some
they in
people-
Wikipedia they
yeah.
talk about it like it actually exists though, but I don't think it exists.
Yeah. I've got an idea for you. Go on YouTube, just because I'd be curious what you think about this. And when I call you in 2 months, this is what I want to talk to you
Okay.
about.
Okay.
There are a lot of people who feel they do have schizophrenia, and they make videos and try to explain to people that don't how. I want you to go look that up and tell me what you think of that.
Well, I think they've been told by a doctor that they have schizophrenia.
But
And I
want
think when a
them
doctor
to
tells you
resonate
something
with
like
you.
that, it changes it. People believe what doctors say because doctors are supposed to know a lot more than regular people.
I don't believe that. I'm a nurse. I know they're full of bullshit. but I would say one step further. You
They need to
can't-
get off their high horses.
They do, some of them. You're
Yeah.
right, some of them, but some of them are amazing.
Well,
And some
yeah,
of them
that's true.
are quite
Well,
on
yeah.
point,
Yeah.
You know? So you
Yeah.
can't say all of it. But
Yeah.
I've worked with some who I'm like, dude, no. But I've
Yeah.
worked with some who I'm like, wow.
Yeah.
They're quite good at what they do.
Yeah, that's
So,
fair. I agree with that.
But what I would say is, if you didn't have people who knew they had schizophrenia coming in and saying, I'm seeing this, or this is how my brain's working, how would these doctors have even started to come up with this? Right? Like, all of these doctors separately just started to come up with these groups of symptoms? Or was it they were talking to patients, they were talking to people who were saying, and this is where I want you to watch these YouTube videos, because it's people saying and trying to convey, this is how I'm interpreting, this is my reality. This is what I'm interpreting as reality. And it has been given the label of schizophrenia. But this is my reality. And how come it couldn't be that doctors then hear that and say, okay, when I hear somebody say these things that I've heard these other people say, I'm going to put them all together in the category of schizophrenia.
Yeah.
Do you get what that's why I want you to watch these YouTube videos and tell me what you think. Does it resonate with you? Are you like, oh yeah, I kind of have felt that or see that? Or are you like, no, I don't. These are people who have bought into this category, if you want to say that, but I don't experience that. And that I'd be really curious.
Yeah.
That's your homework. You got 2 months to do
Well,
that.
Okay.
Okay? And then I gotta skedaddle.
Okay,
go
sure.
Relax and babysit somebody
Okay.
else.
Okay. All right. Okay, these doctors, they are out of control with power, all right? They have no business diagnosing anybody with a mental illness. That needs to stop, like right now. And the funny thing is, they're the ones telling me that I'm the one that's got a mental illness, which is basically, in the old days they called it insane. I'd have to go to an insane asylum. I'm forever branded as a person with a mental illness. You know, it's gotten way out of control. Like, who in the right mind has the authority and the power to demand a person take drugs? Like,
All that. I want to talk about drugs.
so you think I'll be seeing Dr. Bowden for the rest of my life?
Well, maybe not as regularly, but you know, once you've got that diagnosis, is often a lifelong thing, and you're, you know,
There's no way to escape it.
no, unless the only time when sometimes
Suicide, I guess.
No, I mean in terms of if the diagnosis was felt to be psychosis related to cannabis, like related to drugs. Sometimes schizophrenia or another kind of psychotic disorder. So there's nothing you can prevent. Like maybe that's just your genes. That can be very similar presentation and confused with something that's caused by drug use. So
Yeah, but it was all based on a checklist diagnosis of,
Yeah.
she's asking me questions like, am I sleeping okay?
Yeah.
Like, how can you base a diagnosis on questions like, are you sleeping okay?
Well, I think her assessments, you know, are fairly lengthy. It does say in here, you know, possible diagnosis of could be cannabis-induced psychosis. So, you know, if
And what's like the, like what was it? Was it something I said or something that had her come to that
I think you were
conclusion?
having hallucinations and
I've never
delusions.
had hallucinations.
Yeah, and sometimes
She always asks me if I'm hearing voices.
Yeah. You
And I'm
had
never,
that.
well, I'm hearing your voice right now.
Yeah. And it's hard because I wasn't there at the time of your diagnosis. I didn't know you at the time of your diagnosis, and wasn't part of this initial assessment by the psychiatrist. So it's hard to comment.
I feel like a guinea pig.
Yeah. So bring that up with her, that if you feel at some point like if you stop, have you stopped cannabis though?
Well, I was. Well, like when I had the meeting with her, and she said she was diagnosing me with psychosis, I said, this is outrageous. I can't believe what I'm hearing. And I left the meeting and I went home. And 15 minutes later, the police knocked on my door. They came into my house without even having me open the door for them. They just barged right in the door, put me in handcuffs, took me to the psych ward, and put me in the psych ward for 2 weeks while they gave me all sorts of drugs. Forced upon me against my will.
Well, I think, you know, if you're motivated that you want to have a chance of potentially coming off medications, one of the things is going to have to be no cannabis or no drugs at all. Are you still smoking some cannabis?
No.
No. When is the last time you did?
Oh, she took all the fun out of it for me.
So next time you see her, you know, if things have been totally stable and next time you see her you haven't been smoking any
Like,
cannabis,
why is it that
then
some
maybe
people
she
can smoke cannabis and I can't?
Well, there's a theory that maybe, say you were born with a genetic predisposition, say to psychosis, schizophrenia, kind of that spectrum.
On what basis, though? Like,
Well,
what are the examples?
But for some people, if they're born with a bit of a predisposition, if they go along and don't use any cannabis, they'll be fine.
I don't believe in any of
But if you use a
that.
bit of drugs, it can tip you over into having symptoms that need to be treated.
I think that's just all a big, like, bunch of bogus
I don't
baloney.
want
I
to
think
get
it's a
into
bunch
that
of
today
baloney.
in terms of questioning the diagnosis. That's,
Like,
you should talk to Dr.
I
Bowden
mean,
about that.
Now you're messing with her. Now you're messing with her. How easy. Now you're messing with her.
Well, I'm not here to argue with you. I welcome to continue working with you. If you'd like to continue seeing me, you can choose whether you want to continue seeing me or not.
I don't want to, but I don't want to get locked up.
So again, there's nothing you've shared with me today that would make me lock you up at this time.
At this time.
If you
But
become ill, I may not have anything.
what would be indicators of me coming ill? Would it be something I say? Do I not have freedom of speech? Like I feel like my liberty, my freedoms have been taken away from me.
I'm sorry that you felt that.
Like the only escape is suicide. No wonder you ask me if I'm always, if I have thoughts of harming myself or anybody else. Because in this situation, there's no escape except suicide. Isn't that right?
I disagree with you. Like I said, you have
This is
capacity to
harmful
decide.
and unhelpful.
Okay. Well, you have the capacity. If you'd like, I
Like,
can.
what brought me in here to begin with? What were, like, someone recommend me to you or something?
You were referred to psychiatry, and you came accompanied by your wife for an appointment.
Who referred me to you?
You were referred by Dr. Wendy Richardson.
Yeah, well, I didn't like her as a doctor, and I quit her practice. And that was a personal issue that I had with Dr. Wendy Richardson, and I cursed the day I ever met her. Because she recommended me to see you. And my life has been a living hell ever since the first day I saw you. So doctors can just do that? They can just refer people to you, and then all of a sudden you put them on medication and you get them to constantly see a stream of babysitters? She must have had some pretty choice words about me, I guess. Well, I told her I didn't want to see her anymore.
I only, to my knowledge, only ever received the one referral letter from Dr. Richardson.
Well, I guess I have her to thank for all this. And you.
So, Craig, again, at this time...
And why is it that
you're
only you are the only one that's able to tell whether I'm ill or not?
So you were seen
How
by
come
Dr.
nobody else can tell me that I'm ill?
You were seen by Dr. Pham in his
Oh, yeah,
in
but...
the hospital,
And he backed you up?
and the nurses have sent me some concerns with respect to
Based on what, though? What are the examples? What was it that...
your
Was it
belief
something that I
you're-
had said?
your belief that that I'm following you.
Well, you are following me.
You
I
are
can't
a
escape you.
patient-
I moved to Vancouver. I quit my job because of you. I quit my job to move to Vancouver to try to escape you. That didn't help. I got thrown in the Langley psych ward.
Okay, so it would seem that there was concerns about your mental health and behavior at that time as well, by a separate doctor and separate...
Based on what, though?
I wasn't there as part of that assessment. I can look up in the file to see what symptoms you were exhibiting at the time, but I believe it was regarding a lot of paranoia.
Oh, so paranoia is not a natural thing to have.
Do you feel it's a natural thing to have?
Paranoia is what keeps you safe. Watching out for traffic, being a little paranoid of traffic so you don't get hit by a bus, that's natural. It's called paranoia. There's nothing wrong with it. And then how long is it going to be until you diagnose me with schizophrenia? Because I hear that's the next step on the to-do list. Is first you diagnose somebody with psychosis, and then you diagnose them with schizophrenia. Two words that I think were invented by psychiatrists.
So, Craig, my recommendation is to increase the frequency of your injection again, back to every 28 days. You can choose whether you're going to follow through with that or not. It's your choice.
Why don't you give me a lobotomy?
That would not be indicated in your
You know why they
strategy.
stopped? You know why humanitarians came forward and put a stop to lobotomies and straitjackets and all this other barbaric psychiatric treatment? It's because they're inhumane. And so is this medication that you're forcing me to take.
I'm not forcing you to take it. I'm making a recommendation.
You're coercing me into taking it.
In what way?
If I don't take it, I get locked up.
Incorrect. If you don't take it, you might get sick. If you get sick, you might need to be hospitalized.
And nobody else can tell this but you. You're the expert. You're the mental health expert.
I'm a psychiatrist. I am one of many who have done extra training in mental health and understanding wellness.
And you can just take a look at me and see, oh, this person has a mental illness.
It's not just by looking at you. It's based off of the symptoms you endorsed to me, and
Which were what?
in the community.
Which were what? Things that I said, things that when my wife said. So does my wife not have freedom of speech as well? Can she not say whatever she wants about me? Like, I've been persecuted for having freedom of speech.
We will have to, I guess, agree to disagree on that, Craig, because I didn't assess or admit you due to regarding your freedom of speech. I assessed and admit regarding symptoms of psychosis.
And what are those symptoms?
One of the main symptoms is a lack of insight or awareness of the bizarreness of your statements and beliefs.
Bizarreness of my statements? Can you name one statement that was... You know what? I should have the right to say whatever bizarre statements I want. It's called freedom of speech. I should say I'm a hard-boiled egg if I want to.
So, Craig, again, like I said, I'm going to recommend increasing the frequency of your injection.
Yeah, thanks a lot. You're ratcheting up the pressure on me to kill myself, aren't you?
No, I really don't want that for you. Are you planning on doing that?
If I did kill myself, then you could tell everybody that, hey, this is why we had him under our treatment, isn't it? And you'd be vindicated.
Are you planning to kill yourself?
Well, how much pressure are you going to put on me?
I don't want you to.
I mean, you're not allowed to aid and abet someone to kill themselves. That's against the law.
I agree, and I don't want
Harassment
you to kill yourself.
is against the law. Stalking someone is against the law.
So, Craig,
How many times are you going to break the law against me?
you can decline any of the mental health services that are being offered to you. You have that right.
Yeah, but you would love to lock me up, wouldn't you?
I would not.
You'd be right in your
You do not
glory.
become ill. I'm concerned that we've had a breakdown in our therapeutic rapport. And our
Damn
working
right we've had a
relationship.
breakdown. Right from the beginning, right from the first day I met you.
So I'll then ask one of my colleagues if they'd consider working with you instead. You could have a second opinion from one of my colleagues.
What difference would it make?
Well, again, it would be a different doctor,
Thanks to Wendy Richardson, eh?
training, who could then assess, any ongoing need for care.
Well, Wendy Richardson's not going to be getting a Christmas card this year.
Do you wish to see me again in future? Do you want to?
I want a second opinion by someone who's doesn't have an axe to grind. You know, I think you should feel some shame of what you've done to my life. Steady stream of babysitters coming to my house to ask me if I'm eating or sleeping well. Like, I don't need that. I'm eating and sleeping just fine, thank you very much.
Have you been using cannabis again, Craig?
How is that any of your business?
It's regarding your overall health, of course.
Yeah, and if I say yes, you're gonna lock me up because you're dehumanizing me.
I'm actually trying to
You know,
understand your life
it's
experience.
popular for people to smoke cannabis. Do you know that? So why would you make it illegal for someone to do something that's popular to do?
It's not illegal. I have no control over whether it's legal or not.
Yeah, but you're using it against me.
Are you using cannabis? I don't know how I would use it against
How would you know if I'm telling you the truth if I say no?
I wouldn't.
Yeah, exactly. So why bother asking?
Are you planning to end your life by suicide?
How would you know if I'm telling you the truth if I say yes or no? I mean, you're definitely putting pressure on me to kill myself. Why would I want to live if I have a mental illness?
Well, many people.
How am I supposed to ever get in the respect of my peers if I have a mental illness? You've labeled me with a mental illness, and it's damaged my life. Forever damaged my life. So I hope you feel good about yourself for doing that.
So I will put in a letter requesting transfer of care to one of my colleagues then. You have the
Why don't you
ability-
just release me and free me?
I have no control
Do you not
over
believe
you
that
right
people
now.
should be free?
You
Do you
are
not
free.
believe that humans... I was born
May
free.
I speak? Craig, you are free.
I'm not free.
I can't force you to come and see me. I can't
Well, you're
force you to
doing a
take
good
your-
job at getting me to come to see you all the
And I
time.
can't force you to take your medications.
Yeah, but I met people in the psych ward that were in there because they didn't take their medications.
Okay.
That's what happens. You don't take your medications, you get locked up. Psychiatry needs to be put to a stop.
Again, you don't get locked up for not taking your medication.
I can't believe the taxpayers are paying for this.
You get put in hospital if you have symptoms of a mental illness, whether you're taking medications or not. So it's up to you. You can stop taking the medication. You might spend years well.
You might spend years locked up.
No.
Pacing the
that's not
hallways.
it.
Do you think that's a good use for people, having to pace the hallways at a psychiatric facility? I don't. I have empathy for other people. I care about other people. I would never want to put my worst enemy in a situation like that. And you've done it to me, and I've never done nothing to you.
So again, Craig,
What have I done?
you have the capacity to decide.
You just don't like me, I guess.
Whether I don't feel that way at all. I hold you in positive regard.
Mm.
And I hope for the best for you and for your wellness. I believe that taking the medications assist with maintaining your wellness and ability to work.
This sounds like a rehearsed speech.
And you have the right to decide whether you're going to continue your medication or continue meeting with me. I understand that you feel we've had a breakdown.
I wish you would just free me from all of
in our
this.
rapport.
And I wish that I could go back to my normal life. The day that I met you was the day that my life ended. All thanks to Dr. Richardson. We all worked together.
So we're at time today, Craig. I'll send the prescription to the pharmacy. Again, it's up to you if you're going to
So
choose
how often do I have to take these drugs now?
every 28 days, every 4 weeks.
Oh.
We're going back to that schedule.
Yeah. I guess that's my punishment for speaking my mind, eh?
You can
And
also,
having freedom of speech.
You can also decline. You can also stop taking the medication.
Oh, I know what you're gonna do with me if I do that.
I will not cause you to be in hospital
No.
unless you become sick.
What if I decide just to stop meeting with you? Then how will you know if I have my mental health is deteriorated or not?
I won't. If your mental health deteriorates and you come to
who's going to decide whether my mental health is deteriorated or not?
In cases of psychosis or schizophrenia, if somebody becomes quite unwell, oftentimes people around them get concerned.
And so what is it any of their business?
Again, co-workers, bosses, friends, sometimes RCMP or stranger bystanders may notice that you're unwell and may have you brought to hospital.
And what are they experts too? Everybody's a mental health expert? I don't think there's anything wrong with you. What if I tell you that I don't think there's anything wrong with me? Does that hold any weight? No, it doesn't, does it? It's what other people are saying about me, isn't it? Like, I could just say that I don't think you're mentally ill or mentally well. And does that mean that anybody's going to take my opinion for that? Because I could be just saying that because I don't want you to do this to me.
So Craig, would you like to book another appointment with me?
I don't want to get locked up.
I understand that. I don't want you to get locked up either.
Well, you've locked me up 3 times already.
I have not. I was involved in one hospitalization only.
Okay. Well, you got me in the books. You got me in your computer as someone that has a mental illness. So now I'm on the edge now.
So again, would you like to book a follow-up appointment with me?
I wouldn't, but I'm gonna have to.
Then we won't book an appointment.
No, we'll
today.
book an appointment. You can have your way with me, and I'll bend over and I'll just take it like a champ.
You don't have to see me again if you don't want to, Craig.
I don't want to see anybody again.
Okay, then decline the services and don't see anyone again.
And then see what happens, right?
It is be
Yeah, see what happens
You may
exactly.
very well prove your point that you have no mental illness and you'll never be seen by us again.
I don't believe there is a thing called mental illness. You know, there's a book called The Myth of Mental Illness by Thomas Sass, and he's a psychiatrist. He's passed away now, but he says there is no mental illness. There's no such thing as mental illness. It was just invented by psychiatry. Maybe you should check out that book at your local library.
So I'll let you go today. Thank you for coming to see me. If you don't wish to see any of the other care providers,
You know, an apology would be nice.
I am sorry for how you feel.
And what's exactly to us, and we'll get it.
Thank you. You're welcome.
Dr. Bowden wants me to see you to book another appointment.